We'd now like to hear from Ms. Faith Ann Heeren. Ms. Heeren is a third-year doctoral student in the Department of Health Outcomes and Biomedical Informatics at the University of Florida. She's also the founder and president of Oceans, which is Outreach, Community Engagement, Advocacy, and Non-Discriminatory Support, which is a nonprofit advocacy group for adolescents with obesity. We're pleased to hear from her today. Please welcome Ms. Heeren.
Thank you for that introduction, and thank you for having me. I would like to thank the Roundtable for including the lived experience of patients in the morning session and now here in the afternoon session as well. As mentioned, my name is Faith Ann Heeren, and I am a third-year doctoral student at the University of Florida working in obesity research, but I'm an individual who has lived with obesity my entire life, and that is what I'm here to talk with you about this afternoon. Here are my relevant disclosures, but I'd like to note that the content for this entire session is based solely on my lived experience as a patient living with obesity. I was born on January 12th, 1998 to two loving parents. One of my mom's favorite stories to tell about my birth is that they went into the hospital wearing shorts and flip-flops, and when they left, it was snowing. And if you're from North Carolina, you know that that is not abnormal. Now, each year around my birthday, it either snows or a huge cold front comes through. My mom knew that my weight was going to be an issue from a very early age. On this slide is the newest growth chart from the CDC, last reviewed in December 2022, but these probably differ greatly from those that were used when my mom was visiting the pediatrician back in 1998. At each visit, I was always trending in the 99th percentile. My mom knew from the time I was a year old that my weight would be something that I would struggle with. She was concerned and wanted to start a conversation with my healthcare providers to learn more about the ways that she could help me. During one attempt to start a conversation with my provider, they simply replied to her, "Just don't feed her cookies for dinner." At this point, my mom had the information of knowing that my height and weight were trending in a concerning direction, but without any evidence-based advice, she wasn't sure the best direction moving forward. She did the best with the information that she could find on her own. She looked for specialty and online stores where she could find all natural foods to pack for my school lunches, and she even baked sugar-free cupcakes that I could take to school parties with me so that I could have a special treat at school birthday parties and wouldn't feel left out. However, without access to any kind of evidence-based treatment for my condition, I continued to gain weight throughout my childhood and adolescence. Eventually, my mom found the Healthy Lifestyles program at Duke, who offered bariatric surgery for teens. At this point, I had developed high blood pressure and insulin resistance. I knew something needed to change moving forward. Throughout different points in my childhood, both of my parents had undergone bariatric surgery, so I knew what that looked like, but I thought that I would need to wait until I was older. It was still a big decision, so I told my mom that I needed to think about it. A few weeks later, my brother was competing at a science Olympiad tournament at a local university near our home. The gymnasium where he was competing had been built in the 1970s, so the seats were a little bit smaller. I felt the sides pushing painfully into the sides of my thighs, and in that moment, I knew that I needed surgery, and I told my mom that I wanted to start going to Duke. After deciding to move forward with bariatric surgery, my mom drove me to attend monthly visits with the multidisciplinary team. The drive was an hour and 15 minutes each way, so I took the day off of school and she took the day off of work. I had surgery the summer before my junior year of high school. My surgery date was in June. By August, I was running around the tennis courts, having joined the varsity team. I spent junior and senior years of high school playing tennis, prom dress shopping with my friends, and not thinking twice about the endless laps we spent walking around the zoo for the traditional senior skip day. My insulin resistance and high blood pressure also resolved and notably have not been an issue since. This confidence extended to my college years. I spent undergrad having no issues walking around UNC Chapel Hill's campus to get to classes, and spent my free time running 5Ks, playing intramural sports with my friends, and trying out new fitness classes at the Student Rec Center. Having access to high-quality, evidence-based treatment allowed me to recognize obesity for what it is, a chronic disease and not a punishment for a moral failing. During my time in college, I also had the opportunity to establish a nonprofit called Oceans, which stands for Outreach, Community Engagement, Advocacy, and Non-Discriminatory Support. Oceans is an organization that supports and advocates on behalf of adolescents living with obesity, and we offer monthly support groups for other adolescents that are undergoing interventions for obesity. I graduated college in 2020 amidst the pandemic. A few months later, I moved to Gainesville, Florida to start my PhD after living in North Carolina my entire life. The first year and a half of my PhD, I spent in my one-bedroom apartment, attending classes via Zoom, learning how to write manuscripts, and attending lab meetings on Zoom as well. I would occasionally take the socially distanced walk around Lake Alice and FaceTime and Zoom friends from home. In 2021, I met my husband, and about a month into dating, he unfortunately suffered a knee injury that required some extensive caretaking on my part. We were engaged a few months later, so I spent the majority of 2022 juggling my comprehensive and qualifying exams and planning a wedding. I tell you all of that as a way to say that I had not established obesity care when I moved to Florida, and the stressors of my life at that time led to some pretty extensive weight gain. The images I put in the middle of the screen are examples of the MyChart summaries I receive each time I go to a doctor's office through the UF healthcare system here in Gainesville. One of the summaries I've included here specifically is from a visit unrelated to weight. I went to the doctor's office in September 2021 and asked for a blind weigh-in. My reason for asking for a blind weigh-in stems back to elementary school. In elementary school, student nurses, in that instance, actually lined us up each in front of each other and weighed us each one by one. After my weigh-in, they pulled me to the side and told me that if I didn't start taking my weight seriously, I would be putting myself at risk for a variety of adverse health outcomes. My mom wasn't present for that interaction, and I remembered feeling like I was in trouble. What they didn't know, and what was impossible for them to know, was that my mom was working hard at home to tend to my weight, as I've already explained. After that experience, I've had a hard time with the scale, and since then I've been learning to navigate that number. But in this interaction, the nurse taking my weight was kind. She gently guided me backwards onto the scale, but afterwards in the paperwork they handed me, my height and BMI were boldly printed in the bottom right corner of the paperwork, and my aftercare summary, as you can see here, still popped up on my phone. Although it was difficult information to receive at that time, it was a good data point to have later on. When I stepped on the scale in the beginning of this year, 2023, it gave me a number to reference back to and recognize that I had gained weight and needed to reestablish obesity treatment. So in 2023, I started with an evidence-based behavioral weight management program. And because I am a grad student and a patient, I do have some of my very own data points for you. I tracked my weight every day and plotted some of those points here on the graph for you all here. Over the course of a month and a half, I did lose some weight. During this time, I also scheduled an appointment with a provider to discuss anti-obesity medications. Part of my motivation to lose weight included the fact that I was experiencing excessive daytime sleepiness and joint pain. It was difficult to get through the day without feeling like I needed a nap, and the hip pain had become incessant. The provider also required that I complete some blood work, which revealed a few additional concerns. On February 14th, I started taking topiramate in addition to the behavioral intervention I was already utilizing. The green arrow in this chart indicates the last data point on the last slide before topiramate was introduced. Since then, I have achieved clinically meaningful weight loss. I have increased energy, decreased joint pain, and we have a plan to continue monitoring those lab tests that were concerning at baseline. I have responded well to this intervention. I'm satisfied with the level of care I received. And this is a decision I made based on knowing my height, weight, BMI, and that initial blood work. I was able to make a decision and make my treatment plans based on all of the information that I was provided. Unfortunately, I wish that's where I could end this presentation, but a few weeks ago, I came home to a bill. The services that I thought were covered were not. Upon further investigation, the weekend that I received the bill, I learned that no weight management services would be covered by the insurance that I currently have. I know that this story is not uncommon, and I'm sure that many of you have heard it before in your own lines of work. When I scroll through Instagram and Twitter, I often see the stories of other patients who are attempting to access care but are unable to do so due to lack of insurance coverage. I have also seen this issue in my work with Oceans with teens who are seeking bariatric surgery but are ultimately unable to do so due to insurance. For me, this was a wake-up call. I shared with you the story of my childhood, and as a teenager, I did not have any issues with access to care or insurance, and for that, I'm grateful. For the past 3 years, I have been living in the academic side of obesity. Each morning, I wake up, make a coffee, and retreat to my office to open up another Word document. I've gotten to travel the world and talk about research, presenting posters, and meeting wonderful and interesting people. I've had the opportunity to work on exciting papers and presentations and be a part of exciting, innovative conversations, much like the conversations that you all are having today. That bill to me was a reminder of who I am when I get off the plane, close the Word document, and tear down the poster. When I call my mom at the end of a hard day, I'm still the little girl in her arms while she's begging providers for advice and not knowing what the best next steps are. When I'm feeling insecure, I'm still the teenager being wheeled into the operating room, feeling the lump in my throat, knowing that I'm nervous, but making the best decision for myself and my health. And when I go home each night to my husband and my puppies, I'm the new wife establishing care both for myself and in consideration of the new family that we're starting. To be in the academic side is to be a part of the important conversations, but opening that bill made me feel like I was 10 steps behind. I've been on every side of the patient journey. I've had information and had access to treatment, and now I've had information and been limited in my choices moving forward with treatment. Today, you all are having very important conversations about the utilization of BMI as a measurement. Today, I have talked to you about a time where concerning information was presented to me and I was able to act on it, and a time where concerning information was presented to me and my actions were limited. I hope that today, moving forward, we think about no matter how information is presented, we ensure patients can make an actionable plan moving forward that is right for them. I also hope this always includes practicing patient-centered care, where patients have realistic expectations for care and they can openly choose to discuss or not to discuss treatment based on what's right for them, where we can reduce weight stigma and where body diversity is embraced. Thank you for having me.